Well, it's a business spotlight here on WCSJ for this Friday. Mike Williams in with you as on Fridays we talk with the folks at Morris Hospital, and today we are joined by Dr. Syed Ahmed, board-certified cardiologist with Morris Hospital Cardiovascular Specialists. Dr. Ahmed, how are we doing this morning?
Pretty good, thank you.
Good. The topic for today is peripheral artery disease. The doctor is a board-certified interventional cardiologist who currently sees patients at Morris Hospital, the cardiovascular specialist with offices in Morris and Ottawa. So, Doctor, why don't we just take a moment and let the listeners know kind of the basics, what peripheral artery disease is?
Sure. So it is a circulatory condition in which narrowed blood vessels reduce blood flow to the legs, stomach, arms, and head, most commonly in the arteries of the leg. Common condition that impacts more than 3 million people in the United States each year.
So what are the types of things that would cause peripheral artery disease?
Usually a plaque buildup in the walls of the arteries, and as you know, plaque is made up of fat, cholesterol, and other substances. Plaque can reduce the blood flow or trigger a blood clot that could block the blood vessel.
And over time, obviously, you know, the buildup, if your diet is not very good or you're not getting good exercise, those types of things will contribute, right?
Yes.
Now, the risks, of course, there's going to be some big ones here. What can you tell us about the risks of this disease?
The people who have peripheral artery disease have a higher risk of having heart attack and stroke, as the plaque which build up in the arteries of the legs also can build up in the arteries of the heart and in the brain vessels. So if you left untreated, they are high risk of heart attack, stroke. If the buildup is high in the legs, it can cause gangrene and amputation.
Are there some warning signs, some symptoms that people can look for that they might be dealing with this disease?
Yeah, if the plaque buildup is high, they can start to have pain or crampings in their legs due to decreased blood flow in those areas. They can also have gangrene or wounds in their foot, and the temperature in the lower extremities will be reduced, and they have a poor nail growth.
So what are maybe some of the things that folks can do to try to prevent this disease from taking place?
Well, if they see any sign or symptoms that they're developing peripheral artery disease, they can call to our office and ask us to see us, and we can look at them and do some testing to make sure they don't have peripheral artery disease.
And preventative measures, as we mentioned before, with diet and that type of thing, with exercise too. Just do your best to get exercise and eat well.
Yes. Eat well, exercise, control your cholesterol and blood pressure.
One thing we want to let people know about, you can get checked now for peripheral artery disease by taking Morris Hospital's free online assessment. It's quick and easy. It will provide instant results along with a comprehensive 6-page report, including important information about reducing your risk for factors. So if you would like the free online risk assessment, you can go to morrishospital.org/getcheckednow. In addition, Morris Hospital offers an ultrasound peripheral artery disease screening. This costs $40, which shows whether there are blockages in the arm or leg arteries. The peripheral artery disease screening is offered on Wednesdays by appointment. You can call 815-416-6089, or you can call Dr. Ahmed's office directly at 815-705-1000. Doctor, any other tips or suggestions or bits of information about PAD, peripheral artery disease, to let our listeners know?
You know, it is a new disease and a lot of people don't know signs and symptoms. But usually if you're exerting yourself and you notice that you have pain, crampings in your legs, or you have a poor hair growth or nail growth, those are the early signs that you're developing peripheral artery disease. And as I mentioned, people who have established heart disease have a higher risk of having peripheral artery disease. So people who already have diabetes or heart disease, they should have a special look and ask your cardiologist to look at their legs as well.
And the best thing, too, if you think any symptoms might be popping up, get it checked. Don't just assume it's nothing. And
you're right.
Right. Better safe than sorry. Again, the website, morrishospital.org/getcheckednow. The phone number to make a Wednesday appointment for the screening, 815-416-6089. And Dr. Ahmed can be reached at 815-705-1000. Dr. Ahmed, thanks for your time, we'll talk again soon.
Thank you.
It's our Business Spotlight with Morris Hospital every Friday here on WCSJ.